Good evening, everyone. Good evening. Good evening. Welcome to today's session. Um, we are honored to have three incredible speakers with us, each of them bringing a wealth of experience in community leadership and advocacy. First, let me introduce Evelyn Myrie, President of ACA and CEO of Empower Strategy Group. Evelyn is a seasoned leader with over 20 years of experience, known for helping organizations translate vision into action. Her work spans roles in government and business, including positions like Program Director at Status of Women Canada and Executive Director of the Hamilton Center for Civic Inclusion. Evelyn's contributions have earned her prestigious awards, including the Queen Elizabeth II Diamond Jubilee Award. Next, we have Ngozi Iroanyah, an EDI strategist and policy analyst in the healthcare field. Ngozi's passion lies in supporting racially and culturally diverse seniors, especially those living with dementia. Our work focuses on ensuring better visibility, access to care, and equity within healthcare systems. Lastly, but not the least, we are pleased to introduce Charmaine Haughton, a cultural curator, host, and registered early childhood educator with over 30 years of experience. Charmaine also draws from her personal experience as a caregiver for her parents with Alzheimer's, which has deepened our understanding and advocacy for dementia-related issues in the community. Please join me in welcoming Evelyn, Ngozi, and Charmaine.
Thank you for a kind introduction. I'm the president at ACCA, and the Afro-Canadian Caribbean Association, just for your information, celebrates 45 years in Hamilton this year. And it really shows the length of programming and a testimony to the Black presence in this community and the work that our elders who founded the organization have done. And it's quite interesting that many of them are increasingly facing what we call dementia. And we hear it on a regular basis now. This person is presenting symptoms of dementia. So it's a reality for us. Your question about the kind of initiative we do to support people with dementia, it's a little tight, but really we are in the mode of addressing symptoms more than, say, presenting programs for people with dementia. We are endeavoring to work with Alzheimer's Society and governments to really acknowledge and provide supports for organizations with cultural connections to offer programs like day programs and so forth. But we're not there yet, but we are in conversations with other providers such as the Alzheimer's Society. And this report that Dr. Ingrid Waldron prepared certainly will help with be another catalyst to amplify the need for culturally relevant programming. We do provide programs that speaks to one of the symptoms of dementia, or one of the presentation is the lack of isolation, the isolation issue. So we look at issues of social isolation, and we offer recreational programs for seniors every 2 weeks, where about 40 or 50 seniors come out to our event. They eat together, they converse using a cultural lens to really bring that cultural relevance to the conversation. Because the research indicates that as you get older, you tend to gravitate back to your original language and so forth. So the program we offer acknowledges that and create a safe space for older people, seniors, to participate in community, which is a very important piece, is to participate in community, to be more socially connected. Those are some of the ways to address or to mitigate dementia. So we're not in the business yet of offering programs to respond to dementia, but we're in the business right now of providing programs that would help to mitigate the issues that we've seen presented around dementia. And as I said, we are in conversations as well as a research, and more research shows that a number of Black people who are presenting dementia. We know that there's a need for cultural relevance in programming. So we are looking forward to continue to engage in that dialogue to get resources, provide some kind of day programming and whatever the needs are in our community to respond to that. So I hope that answers the question.
Thank you for having me. I'm very honored to be here. Just a little bit of an introduction. I'm actually the Director of Health Equity and Access for the Alzheimer's Society of Ontario. I used to work for the Alzheimer's Society of Canada, so I do have that national and provincial perspective. In terms of services that the Alzheimer's Society offers specifically for Black populations, we haven't yet developed any culturally specific programming. However, we are in development with certain community organizations to bring those about. In the meantime, though, we do have a number of services at our local society. So if you're with the Alzheimer's Society of Toronto or Peel or Durham, we do offer counseling support. We offer support groups as well. I've taken some support groups myself for my journey. They were very helpful. We do offer educational resources as well to help you understand the trajectory of dementia and what to expect if you are experiencing it.
Hi, everyone. Thank you so much for inviting me to this discussion. I personally, at the moment, don't have dementia. I don't know as I get older if that will happen, but my father has dementia. He's had it for over 15 years now. So I've been an onlooker as what's happening in his life and in our family as we're navigating all the different changes that's happening to him. What I found, the first thing I remember was that we were all in disbelief and we weren't, nobody was really doing anything or going to a doctor per se to find out what the cause, because he kept repeating himself and he'd like driving, he'd forget things, or it seems like subtle little changes. And then one of the good thing is because my father has had an underlying health condition, in our case, getting diagnosed was not as challenging as some of the other people that I know, because he was associated with he had a family doctor and he's had that one for many years, and he was at St. Michael's Hospital being treated. So when my stepmother mentioned something to them, they were able to direct the two of them into where they needed to go and find out what exactly was going on. One thing I do remember also is that in our community, and traditional medicine and holistic medicine is great. I'm not knocking it because I do agree, but I find that our community will lean on that first. They won't necessarily say, let's go find out what exactly is wrong. They will tell you things that they've heard other people take in, or a story about some other person. So it took them a while to say, you know what, this is serious. It's more than just memory loss. We need to go and check it out. And when that was checked out, they were able to get answers a little bit faster than maybe others, because they had practitioners in place to help them. Unfortunately, not everybody in our community have a family doctor or have people that they can go to, and there's not a lot of information. So I could see that it would be more challenging for others in our community as opposed to people who have some sort of a support.